These next two topics kind of go hand in hand, but we're going
Yeah.
to start by discussing the first one from NPR. Diseases are spreading, and the CDC isn't warning the public like it was months ago. I'm a huge public health person. I really care. I really do care about your health. I care about my health, and I care about how our society functions or doesn't function based on the health of its people. And we are not okay. Like, none of us. Like, people are not well. Um, and so this is what has been stated for in NPR today. It says to accomplish its mission of increasing the health security of the United States, the CDC states that it conducts critical science and provides health information to protect the nation. But since President Trump's administration assumed power in January, many of the platforms the CDC uses to communicate have gone silent. And this is true because I check the CDC website all the time for various things that I'm interested in, and nothing is being updated. Many of the CDC's newsletters are stopped. I haven't received any. Workers at the CDC have said this. Health alerts about disease outbreaks previously sent to health professionals subscribed to the CDC's Health Alert News Network, haven't been dispatched since March. The agency's main social media channels have come under new ownership of the Department of Health and Human Services. Yikes. Emails reviewed by the NPR show this, and most have gone more than a month without posting original content. This to me is so disgusting. And I don't ever want to hear anybody talk about RFK making America healthy again, that whole Mayha
Right.
movement or whatever. All they have done since assuming power is strip the American people of health knowledge and have reduced our chances of being able to prepare for another pandemic, which is right around the corner. Actually, two, I believe, are right around the corner. The fact that we've had measles outbreaks and there's been no real communication around that. The fact that we go in and out of these COVID waves, they're not seasonal, they're happening all the time. I think we need to be bracing for another one that's coming around the corner here in June because a new Omicron variant has kicked up, and we do not have a vaccine ready for it.
Yeah.
There is just so much to unpack with all of this. But the real thing I wanted to touch on is because the news cycles have moved so fast, we've kind of moved away from this topic collectively. So I was really happy that NPR posted something about this, because this is like we are going around with blinders on, bumping into walls as it pertains to public health. And I have talked to so many scientists and so many people in public health over the last few months. A lot of them are losing their jobs. A lot of them are being redirected. They're not allowed to work on the things that they used to work on.
Yeah.
It's impacting every single aspect of public health, and people are getting sicker because of it. And now we're going to be cutting Medicaid and Medicare and SNAP. What do you think that's going to do, guys? What do you think that's going to do? We're flying blind, and now we're not even going to have any tools to protect ourselves. This, to me, is the epitome of madness. This is eugenics, and no one can convince me otherwise. We are trying to cull the herd here. We really are. And I'll explain more when we get into the COVID conversation of what I mean about that. But there is no public health. There's no way that this could be a public health strategy other than a strategy to harm and to kill. That's the strategy.
I know that a lot of people took a lot of stock in RFK when he was like appointed as, you know, uh, the head of Health and Human Services. But I think the thing that's really deflating for me is the conflation between understanding that there might be a problem in society and then what you do to try to address it. So RFK was coming, out making some popularity for himself by challenging the fact that there might be some issues with how we go about addressing disease in this country, how we go about addressing health in this country. And I think to a degree, there is some truth behind that in the abstract, in the absolute abstract. When we talk about how maybe we as a country, we don't actually prioritize wellness as much as we do just addressing sickness. Once people are sick, then we go to the doctor and we get care versus thinking about how can we prevent that from happening in the first place by living a more healthy lifestyle. I
Mm-hmm.
think there is some merit to that. But the problem is that people will say something like that. And then when they actually get into a position of power, what they end up doing is just finding different ways to not really address that point whatsoever, but trying to find ways to take the existing things that are keeping people safe and cutting them in every way imaginable. That's what we've been seeing from RFK since he's taken this position as a director of health and human services. And I just do not see how anyone could see what he's doing and think to themselves, this is actually a good thing right now, other than the fact that we had right wing propaganda spewing a lot of misinformation and disinformation about vaccines, about the CDC, because of the fact of the COVID pandemic. And so now people don't really think that the CDC is anything other than just like a vaccine pusher. And they've been seeing a bunch of misinformation and conspiracy theories about vaccines. And so now I think all of this is just a direct result of, unfortunately, what I like to call the information war,
Yeah.
where we are in the middle right now of being in a time where truth is less relevant than it used to be. And what's more important, unfortunately, is just how often and how many people you have out there saying a certain narrative. And so we have too many people right now in this right wing political sphere essentially demonizing everything around the world of science. And these are the repercussions of it, Natalie. These are the repercussions of all of these lies going unchecked for so long, right? Because now you have somebody in power who wants to do nothing other than to strip the protections away from people that have been in place for so long.